really interesting one, and I can remember when I first experienced this thinking this cannot be related to anything, I must just be going mad. But it's your feet getting incredibly hot, especially at night when women are trying to get to sleep, but not necessarily so. Is this also a menopausal symptom?
A lot of women do complain about feeling hot, especially at night. Usually generally all over, especially their chest, and end up with pools of sweat on their chest between their breasts, and they can end up with wet nighties and duvets and throwing things off and on. But for some women it seems to be concentrated in their feet, and they get particularly hot feet, and this can be very disturbing and very difficult. You can't exactly have a bowl of cold water by the bed to stick your feet in. I suppose you could.
I mean, I think experience of the menopause is very individual, and some people complain about their feet. I've had people complain about burning tongue or burning mouth or fingers. So it's extremely individual. And sometimes it can be difficult to know whether it's menopause related or something else, and that's where you may have to have a trial of hormone therapy to see if that benefits and gets rid of the symptoms before you can actually make the diagnosis.
Is that why you would recommend that any woman who's experiencing any of these symptoms that we're going to go through to keep some sort of diary and checklist so that you can see if there's anything cyclical, whether there are changes over a few months that maybe you can say are related to something else, or whether it makes it easier to pinpoint whether it's a menopause?
I think diaries are excellent, and certainly that you mentioned cyclicity. I think that's one of the things which is often missed if a diary isn't kept. With one of my other hats, I'm chair of the Premenstrual Syndrome Society, and many women come many years after they've started to experience these symptoms with symptoms they didn't even realise were cyclic, or their doctors didn't realise. And particularly around the perimenopause, this is a time when hormone levels are changing, and so you can get the perfect storm of PMS and menopause symptoms happening at the same time. And we can tailor-make our treatments according to what the diaries are telling us. So I think that's really important.